Just wanted to make sure I knew what buttons. Okay. Hi, everyone. It's really good to be here with all of you today. I really appreciate you taking the time to come be with us for our presentations. It really means a lot to all of us. So the title of my presentation is Listening to Doulas in Southern Oregon, and I chose this title because I was inspired early researching and finding these series of studies called Listening to Mothers. So there's been several of them, and they're qualitative studies looking into the experiences of women giving birth in the United States. So it kind of was aligned with what I wanted to do. And it's actually a picture of my doula bag. So I've been a birth and postpartum doula for 7 years. And I just use it as an image of like, this is your go bag, and kind of the profession of a doula is just so unpredictable. You need to just have things you need hopefully with you and see what happens during the birth experience. So what is a doula? A lot of folks are pretty confused about what a doula is, and for good reason, because this is a historical role that humans have always had. There's always been people literally supporting others giving birth. So giving it a title can be a little confusing, as we've over the past 100 years privatized birth into a different medicalized experience rather than a social and community supported event. So the term doula was actually just coined by some researchers in the 70s. And that was really interesting because it's not a very well understood or received term. And it's kind of at odds for the role in the sense that it's a Greek word meaning slave. So as you can imagine, the movement of supporting people giving birth in this new modern landscape is kind of at odds with the terminology of being called a slave. And we'll get into that later about how that kind of affects the understanding of the role and the value of the role and the limited respect that people receive with doing birth work. And I just wanted to include these images because you can find tons of images throughout the world and over time about just the importance of having somebody with you giving birth. So why is this important to talk about? The United States, unfortunately, compared to other industrialized countries of similar populations, has the highest amount of infant and maternal deaths, which is really concerning because other areas in the world, it's decreasing while we're seeing an increase. And as you can see, this is very much affected by the person giving birth's ancestry. So we see much higher rates of maternal deaths among Indigenous people and people of African American descent. So I wanted to include too, there's a huge difference with trying to do this type of work in a rural setting. For one, there's a lot less people in Southern Oregon compared to Matoma County. And also it's just very spread out. So on top of being really large, less people, we also have different demographics here. So we have a much higher amount of people living in poverty, which can obviously affect outcomes and access to care. And then also when we look at the amount of folks identifying as Indigenous, we have quite a higher number here, as well as Hispanic and Latine people. And I included too, one doula just mentioned, hey, the roads are really dangerous in the winter when we have to travel so far to try to get to a birth. And this can be anytime, day or night, and you just kind of have to try your best to be careful. And I wanted to compare these regions because there was a 2018 study commissioned by the OHA to look at the doula workforce because in 2013, there was a House bill adopted into the legislature to give access to people on OHP Medicaid, access to doula care. So before that, it was very much kind of seen as this like elitist privilege type of care that you would have. So the idea was to give access of those folks, which are 42% of people giving birth annually, access to this care. And more importantly, these are people who have, more vulnerable backgrounds, and they just probably have gaps in their care already to begin with. So when they did this study to see how many doulas were here, there was less than 10% of the people they got in touch with were from Eastern or Southern Oregon. So the whole side of the state, just really like a lack of people doing the work. And also importantly, most of these narratives and the data we have on birth workers, they're all primarily upper middle class, white women in their 30s that don't necessarily have to do this for a living. So not a lot of voice to people of any other backgrounds. And this is important too because we want to recruit people to have shared lived experience to be able to actually provide culturally matched care and things like that. But the barriers are higher for these folks trying to do the work. Also, all of the major research on birth and birth workers is really centered on the medical side. So the benefits of having someone with you, less chances of cesarean, less adverse experiences giving birth, but really like a pretty large lack of experiences of the people actually doing the work. So I really wanted to tap into that. So I used for my main questions, the motivations of people coming to the work, what challenges they were facing, and asking these folks, what are the most important skills that you need to have to do this work, right? And what has surprised you the most in your experiences doing doula work? And then most importantly, what are your hopes and goals, right? We really want to know how to support these people doing this really challenging but very important work. So the structure of my research study was qualitative research, and it was approved by the IRB, and it does adhere to the American Anthropological Association ethical guidelines. And I really focused in on grounded theory and constructivist theory to guide my research. Also, I made sure, obviously, all the participants had informed consent and that they could withdraw from the study at any time. So I conducted 7 interviews with people in Klamath County and Jackson County. And they were open-ended, semi-structured style, lasting about an hour. And then I transcribed those interviews verbatim and then proceeded to code them for themes. And I wanted to include, I really had a strong background with Indigenous research methods here because I wanted to really relate and connect that relational accountability with my work, because I'm not an outsider coming into the community. I've been actively working in the community. I'm a mother myself, so I have all of these intersecting identities as someone of Indigenous and settler ancestry as well. So I wanted to really hone in on giving the respect to these collaborators and honoring them for their contributions to my work. So here's the major findings from asking people why they wanted to come into this wild line of work. They either wanted to support people in their own families while they were giving birth and have that information on how to effectively do that. Or they found themselves, several of them, just being in a caring role, like an older sister, or somebody who took care of their siblings. And they thought that would work well with their own skill set. A lot of them had a lack of support in their own births. So they saw this as a way to try to prevent that happening to other people. And then also to fill a need in their own community. So these are people who really strongly feel connected and part of their own communities, wanting to improve outcomes for people giving birth. Also, a lot of people just really have always liked babies and been interested in childbirth. So that's a very common theme throughout the interviews. So the major findings that I found to be extremely significant after all the themes and all the coding I did was that among all the Indigenous doulas I interviewed, and I didn't ask any of them what their birth experiences that they had themselves were, but all of the people I interviewed told me their birth stories. Very significant. And so the kind of like heartbreaking thing was that all of these Indigenous people who were trying to pursue birth work had traumatic experiences themselves. In addition, they faced many barriers on many different systems and institution levels, racism, discrimination, but also in their own communities, trying to reconnect traditional practices or find access to these traditional birth practices within their own communities, either from a lack of information based on things of, like colonialism, and just people being apprehensive about it in their own communities. So people in their own communities really just being concerned about bringing these practices back or how they might be perceived. All the doulas I interviewed also were not just doing doula work. They all had children of their own to take care of, and they all worked other jobs and or went to school on top of this. So this is a very common theme among birth workers, and this shows up in other literature that we see from people in California and in Canada, that these are folks that are just doing a whole lot. at once. And so despite having issues with getting paid, having enough work to do full time, facing all these barriers, every single person thought it was a good career choice when asked, except for one. One person was hesitant to say that it would be, but theoretically, if things improved, it would be a good career choice. A lot of themes among challenges and barriers to the work. A lot of these stem from insufficient trainings. So the trainings provided are very short and they don't really prepare people for working with folks from diverse backgrounds or low income or people with trauma. And also many people really reflected the need for wanting to mentor or shadow more experienced people doing the work. And there's a lack of that as well. When the pandemic hit, that was additional barriers. So in addition to all these other things, the doulas were restricted largely from hospitals altogether throughout the pandemic. And even now, there's a very specific hospital-based access issues that we're facing, even though it's recommended that we be let in. We're part of the care team. Business and marketing is not something that you just know how to do one day. So that was something very commonly expressed throughout the interviews. And things like imposter syndrome, right? How am I good enough to do this work? Do I know everything I need to know? Can I do all this? And so systems and institutions trying to interact with folks in the hospital, which often takes years to build trust. That was a really common thing that also links with other research that has been done on birth workers. There's a very big suspicion within hospital systems and among providers about what a doula's role is, and they see them as sometimes threats to their own roles. And so this is also problematic because that spreads out into the greater awareness of what a doula's role is. Some people really confuse them with midwives quite often. So there's even midwives themselves sometimes aren't supportive of doula's work because they see them as overlapping with their own roles in some way. Let's see. Oh, I went the wrong way. No. Okay. When I asked folks what they were surprised about with doing the work, okay, every birth is so different. That came up so many times throughout interviews. And also people were just surprised when they got into the work how many interventions these people were faced in their births. The skills they believe are so important were to listen, which is so powerful. And just the presence of being there for someone continuously is so important. Having focus, being trauma informed, being good at leaving your own shit at the door, right? That was expressed as being very important. And also their goals, which I found was so interesting that everyone wanted to have a space. And I feel like that lends itself to being valued and respected in the profession. Like most people have offices, right? If you don't have an office or a physical space to share with folks, that value and that perception of the value of the role of a doula can be greatly diminished. Also, people want to do this full time. They need support to do this. It was significant that people said, this is literally my favorite thing I've ever done besides be a wife and a mother, which really was heartwarming to me. So in conclusion, there's so many barriers to the work, but it's so important. And I bring my own experiences into the work. So I want to acknowledge how this has influenced not only the research, but the results of the research and the interactions I had with these people. Whereas if I was an outsider, I wouldn't have had the same depth and wealth of information. And just wanted to thank you all for joining me and appreciate it. Any questions or comments or anything? I'll come back to you, Eli. Okay.
You mentioned like the medicine and also like the business side of the skills. How would someone go about kind of getting in contact with what they were?
Right, that's super variable. It's unlikely that providers would refer them, even though it's covered by insurance. So usually people like Google them. But in my experience of 7 years of living in Klamath County, it was word of mouth. So if people know you, then they're like, oh, you're that person that comes to births, and that's oftentimes how it works. Yeah, sometimes there's agencies too. There's agency models and things like that. So it kind of really depends on where you live. Not for this group of people, though I do know some that are. And so that is interesting because there's people who are very young who've never had children that come to the work, which I find interesting. But then there's also people who, as you said, are elderly that want to kind of come into that almost grandmotherly type role and mentor the younger generation, which I think is really interesting.
Thank you, Katie.
Thank you.